We're constantly learning about variants as we're going along. And of course, we try to look towards other countries in the data, such as the United Kingdom and elsewhere, because they were ahead of us in terms of the knowledge. And so we take into account what we learned in that context. But of course, Canada is not the same as England and didn't have the same set of conditions. And we hadn't sort of loosened our measures and put on the brakes just around that Christmas sort of time period as well in many jurisdictions. So the context is a bit different. So we were anxious certainly to get some Canadian data on, how transmissible is the variant. The predominant one, as I said in my opening remarks, is the B117. And I don't know if you've seen some of the Ontario data, but that's where a lot of the B117 variants are occurring. And their initial estimates in that context for the reproduction number is that is sort of over the 1.2 mark, whereas the current estimate for the reproduction number for the strains prior to that is now just under 1. So there is a difference in transmissibility, of course, between the B117 and the rest. And that might be a little bit lower than what we were seeing in the United Kingdom. But that's also because of the great work that people have been doing in the public health measures. As we see those public health measures ease, that reproduction number may well change due to a complexity of different circumstances. So I think it is really important still to be very vigilant about these variants. They are definitely more transmissible. I've heard accounts of actual outbreaks where the attack rate was that much higher with the B117 variant. Very difficult to stop once this starts.